Why don't everybody go for therapy? In this video, I will talk about why therapy is not for everybody and why therapy does not solve the problem at the root level. I have myself been through a lot of struggles, and from my own experience, I can tell you that it is people who have gone through similar roads, who have taken similar paths, that help us the most. If you see the doctors who treat us physically, if we have ailments at the physical level in our body, the doctors have studied the body. It's a very visible object. It's a visible entity because there are parts of the body and there are different doctors specializing in for different parts of the body. They know about it because they've seen it in and out, they have analyzed it in and out, they have studied it in and out. But the same does not apply to the psychological problems. So when we go for a therapy, and I've been to one also, you end up being told a lot of things that may not apply to you. It's a lot of information. Sure, they listen to you, but if you look at the root problem, at the root level, the problem still persists. You may feel well after the therapy, but the problem doesn't go away. How many of you have not gone through the same thing, where you feel you're over some problems, but it recurs. It recurs because therapy does not solve the problem at the root level. So what I'm suggesting here is there's a way to solve problems at the root level. If you have struggled in your life and if you have overcome something, you can definitely help other people in that. And this is what is missing in the world. We do help other people, but if you look at the professional help, where do you see people who approach other people because they have overcome some problem? Do we even ask them? We might ask people who are near us, but even there is a bias. What I'm suggesting is, if people who have survived, people who have overcome challenges and problems, especially the psychological problems, they are the ones who are capable and rightly as enough to help another person who is going through similar problems. Because they have overcome a problem, if I have a problem, I can come to you. If I know you have overcome that problem and faced that in your own life, by listening to you, by talking to you, it's a very targeted approach. It's a very targeted problem solving method, and it's literally non-existent today. For example, if you go for relationship problems to a therapist, right, and the therapist does not know what you've gone through, they may not be in a relationship, or they may be in a much better relationship, they may not have faced similar problems that you have faced in relationships. How can they help you? They can give you suggestions, they can make you feel better, but it does not solve the root of your problems. To solve the root of your problems, first you need to dig deeper into what the problem actually is. And then you need to find a person who has gone through a very similar problem and who has overcome it. And you come to know about such a person only if there's a way to do it. And this is the gap that I'm talking about. It's a huge gap. If there's a problem with your eye, you know there's eye doctor to go. There's a place where you can go, you can get your eye checked, you can get it treated. If you have a problem with your teeth, you can go to a dentist. There's a proper specialized person for it, and there's a whole profession for it. Same applies to all the other parts of the body. But when it comes to the psyche, that's where the problems begin. And whoever is trying to be an expert in solving psychological problems, without themselves having solved those problems or gone through those experiences, is just deluding on the people. And this is really unfair to the person who goes to them to get the problem solved. First of all, they're not well informed about what to do about their own problems. And then they go to a person where they're being given information. Sure, they would be given a lot of tools which might help at the superficial level, but the problem is a recurrent one. For it to solve permanently, the root has to be eliminated. For the root to be eliminated, one must have gone through that problem themselves. So it's only then they can see the problem in the other person. Take for example, narcissism. I have been through narcissist relationship. And if a person who is going through narcissistic abuse comes to me because I have overcome that particular trauma, I would definitely be able to help them, because I for sure know that I have overcome the problem of the abuse and that it does not affect me anymore. It's only then can I help that person who comes to me, and it's only then that a person can be truly helped. Without having had gone through those experiences, how can a person help another person overcome a similar problem? That there's a dire need and there's a huge gap in this particular area. Take childhood trauma for example. Sure, in psychology and in therapy, a lot of useful tools are provided. It definitely helps. It has its own place. It helps in observing what has happened. It helps in analyzing what has happened. It provides a lot of psychological tools to cope with the problems that come up, the triggers that show up, the after effects, all the traumas that come up with childhood abuses. But if the therapists themselves have not gone through childhood abuse and they're giving all this information to their patients, I personally do not think that's going to work out. This might sound really blunt, but it's only when a person has overcome their childhood trauma, be it through the help of therapy, be it through spirituality or science or whatever it is, it's only after a person has overcome their childhood trauma can they help another person who is going through that after effects of the childhood trauma. Because I myself have gone through that. It took me 34 years to overcome the problem. And when a person knows and has that information that I have gone through something similar that they are going through, and they want to solve the problem in their life, and they have that deep zeal to solve it, they want to solve the childhood trauma, and they come to me because I would have shared about the traumas that I had, about how I overcame it, and that would make that person feel more confident. That would make the person feel more connected, that somebody gets them. That's how a problem can be relatable with two people. Sure, two people can talk about the same problem, but if both have not experienced it, or if either one of them has not experienced it, then what they talk about is really superficial. It is just hearsay. When the person has had a lived experience about the problem and has overcome it, has been through that challenge, has walked that path, it's only then can the person help another person solve a problem. There is no profession for this right now. But the closest word that comes to me is it's called a survivor. It's a survivors who overcome these problems psychologically, and because they're a warrior, they stuck with it. They did not give up. They overcame all the problems that they faced, and then they're standing again on their feet. And if there's another person who is struggling and unable to stand on their own feet and don't know what to do, that's when it becomes more important to find another person who has overcome that problem and seek out help. Being a survivor is not a small thing. A lot of people do not even realize that they are survivors. Very few would be aware of the amount of inner work that they had to do to overcome particular problems. Many of them do not ever work on their inner world. Many of them just sit with their coping mechanisms because their coping mechanisms becomes their way of life. It's only when a person is aware of their coping mechanisms, is aware of how they react, is aware of how they get triggered, is aware of all those years that they have lived in that trauma. It's only then that they can see the shift, the change that they had in their life of before and after. It's a huge shift. It's as if the person cannot recognize who they were before. It's that kind of a shift which becomes a radical turning point in a person's life. And this shift doesn't happen overnight. It's not a one-time event. It keeps happening, and these are subtle realizations that happen in a person's life. And for a person to have those subtle realizations, they need to be really aware of the mind, and that's where sensitivity comes into picture. That's where questioning comes into picture. That's where self-conversations come into picture. That's where not being affected by the society comes into picture. There are many factors, and being a survivor is the most beautiful thing after you have overcome that. And it's only human to help another person who is a survivor themselves. We all struggle in life, each one of them. Each one of us have that dire urge to solve problems, to come out of our struggles, which is why the poor just does anything and everything to become a better person. And if a person is born into a rich family, they would not know what struggle is. They would have their own struggles, definitely, but a person who rises from the ashes, the struggles that is unmatchable. Definitely, all people have their own level of problems, but the survivors of the psychological problems, they are the ones who can deeply help another person, deeply help them overcome a problem that they thought they would never overcome, that they had no clue how to go about. That's where survivors come into picture, where one survivor helps another.